My name is Robert Redwood. I go by Bobby, and I'm the Chief of Emergency Medicine at Cooley Dickinson Hospital.
I'm Tanvira Zaman, and I am a pulmonary critical care doc at Cooley Dickinson.
I am a frontline emergency clinician. I am in the chairs with everyone else, seeing our patients and keeping our community safe.
Spent a lot of March and the beginning of April in this preparation phase, not knowing what to expect. And then in April, we got a lot of very sick patients.
I'm a dual-trained emergency medicine and preventive medicine physician. Preventive medicine is the medical specialty of public health, and so I'm particularly passionate about vaccination and preventing pandemics like the one we're in and getting our society out of this.
We got to know these patients, and then we lost a lot of them, and it was very sad, and I think it's been a somber time in the hospital.
It was a huge day for us. So previously it took 6 years to develop vaccines, and this vaccine was developed in 9 months. It is a testament to modern science. It is incredible. The amount of resources that were thrown into this were worth it.
It was joyous. It was the first time that there was like nice, positive, everybody was happy kind of energy here at work, which I've missed.
So I believe I was the first one to be vaccinated, and for me this was a personal milestone because it's a service. It's a service not to myself but to our community, to my family. I have a new baby at home, and ultimately to the world.
I have a mother-in-law and a father-in-law who are 78 and 79. We haven't had dinner with them in months, and they only live 7 minutes away from us, and it feels like, you know, maybe sometime soon we'll be able to be a family again.
This was an interesting year, 2020, and there was skepticism surrounding the vaccine because of concern that there might have been political pressure in terms of its development or its approval. And I just want to assure everyone that the science on this is sound. It has been not just vetted, but extra vetted. The CDC looked at this vaccine closely, the FDA, the New England Journal of Medicine was asked to do an independent review, and a really careful review. They were looking for flaws.
I just got it on Friday. It's amazing and wonderful. As I said, when this all happened, there was a lot of fear and anticipation. Then we had the very sick patients, and we didn't know if we were going to get sick also.
This is a pattern that I hope we see spread like wildfire, because the more of us that get vaccinated, the quicker we'll be out of this pandemic. It's also essential that we get a critical mass vaccinated, because if we don't, if we under-vaccinate, COVID could become a chronic disease where we have seasonal COVID outbreaks like we do flu, and there is a potential that we could actually eradicate this disease, get on top of it, and never see it again. And so I'm really excited and hopeful that the rest of society follows our example here and gets the shot.